how you take a downsell is, for example, if patients come in and they need the shockwave, a lot of times my downsell is, okay, we'll try this other stuff for 2 or 3 weeks, night splint, foam rolling, morning stretch, new shoes, things like that. And if you're not getting better, then we'll reassess you with an ultrasound. What really helps me is the ultrasound, because I can show them physically how there's thickened fascia in one side and less thick on the other side, and that really helps me out. But I'm okay with waiting 2 or 3 weeks if they're okay waiting 2 or 3 weeks, but it just delays the improvement. And then when they come back, they're not ready, then you can do the following. You can say, okay, if that's too much, that $1,500, because you can pay as you go. If that's still too hard, they can use care credit. And then sometimes if they're not ready to do the shockwave, you can, instead of doing 6, you can do 3. I haven't really thought about this as a downsell, but it kind of is. So if they're not ready, what I used to do is I used to do 3 sessions of shockwave, a 6-week break where they went to PT, and then another 3 if needed. So you could actually do 3 as a downsell. The problem is if you're doing that 3, you kind of get used to that, and you're not really offering what really gets them better. What I find really gets them better is 6, and so sometimes it was a cop-out when I went down to 3. So another thing you could do for a downsell, I had a patient the other day, they weren't ready for shockwave, but they did have a very pronated foot, and they wanted to do a downsell as an orthotic. So I think downsell as an orthotic is another way of doing that.